5. Limit caffeine and alcohol. Excessive caffeine and alcohol intake can impact fertility, so consume them in moderation. 6. Quit smoking. Smoking can reduce fertility, so kick the habit for a healthier reproductive system. 7. Adequate sleep. Ensure you get enough quality sleep to support hormonal balance. 8. Stay hydrated. Drink plenty of water to keep your body well hydrated. 9. Nutrient-rich diet. Include foods rich in vitamins and minerals essential for reproductive health. 10. Folic acid. Intake. Take a prenatal vitamin with folic acid to reduce the risk of neural tube defects. 11. Reduce toxin exposure. Limit exposure to environmental toxins that can impact fertility. 12. Know your ovulation signs. Recognize ovulation signs such as changes in cervical mucus and basal body temperature. 13. Optimal sexual positions. Certain positions may increase the chances of sperm reaching the egg. 14. Regular intimacy. Aim for regular intercourse, especially during your fertile window. 15. Reduce stress. Practice stress-reducing techniques like meditation or yoga to promote fertility. 16. Avoid lubricants with spermicidal agents. Choose fertility-friendly lubricants to enhance sperm motility. 17. Limit hot baths and saunas. Excessive heat can negatively impact sperm production, so avoid prolonged exposure. 18. Partner's health matters. Ensure your partner maintains a healthy lifestyle for optimal sperm quality. 19. Medical checkup. Visit a healthcare professional for a preconception checkup to address any potential issues. 20. Patience and persistence. Understand that conception may take time. Stay positive and persistent. Remember, these tips are general guidance. If you encounter challenges, consult with a healthcare professional for personalized advice.
Welcome back to our channel. Today, we're diving into a topic that many of you have requested, the early signs of pregnancy. Whether you're trying to conceive or just curious, these symptoms could be indicators of an exciting journey ahead. Point 1. Missed period. One of the most common early signs is a missed period. The absence of your regular menstrual cycle could signal pregnancy. Point 2. Breast changes. Pay attention to changes in your breasts. Increased sensitivity, tenderness, and darkening of the areolas might occur. Point 3. Fatigue. Feeling unusually tired or exhausted. Pregnancy hormones can cause fatigue. Point 4. Nausea and morning sickness. Many pregnant women experience nausea, often referred to as morning sickness. It can occur at any time of day and might be triggered by certain smells or foods. Point 5. Frequent urination. Have you noticed yourself visiting the bathroom more often? Pregnancy can lead to increased urination due to hormonal changes. Point 6. Food aversions and cravings. Your taste preferences might suddenly change. Cravings for specific foods or aversions to others could be a sign. Point 7. Mood swings. Hormonal fluctuations during early pregnancy can impact your mood. Don't be surprised if you find yourself feeling emotional or irritable. Point 8. Abdominal bloating. Some women experience bloating or a feeling of fullness in the abdomen. It could be attributed to changes in hormones and digestion. Point 9. Increased basal body temperature. If you've been tracking your temperature, you might notice a sustained rise. This can indicate pregnancy, but it's important to track consistently. Point 10. Implantation. Bleeding. Spotting or light bleeding might occur when the fertilized egg attaches to the uterine lining. It's often mistaken for a light period. Conclusion. Keep in mind that these symptoms can vary widely among individuals. If you suspect you might be pregnant, it's always a good idea to take a home pregnancy test or consult with a healthcare professional for accurate guidance. Outro. Thanks for joining us today. If you found this video helpful, don't forget to hit that like button and subscribe for more informative content. Remember, every pregnancy journey is unique, so stay informed and take care of yourself. Until next time. Sure, let us break down the key points for each trimester. First trimester, weeks 1-12, early signs and development. Overview of conception and early fetal development. Common symptoms like morning sickness, fatigue, and hormonal changes. Importance of prenatal vitamins and a healthy diet. Weeks 5-8, organ formation. Formation of vital organs and major body systems. Discuss potential early ultrasound and first heartbeat. Weeks 9-12, transition to second trimester, gradual reduction of some early symptoms. Introduction of prenatal screenings and tests. Second trimester, weeks 13-16, visible changes, baby's growth spurt and noticeable changes in the mother's body. Announcement of pregnancy to friends and family, week 17-20, gender reveal, discussion on when and how gender can be determined. Introduction of anatomy scan and potential genetic testing. Weeks 21-24, viability and quickening, fetal viability milestone. First experiences of fetal movements quickening. Third trimester, weeks 25-28, final trimester begins, overview of the home stretch. Importance of monitoring baby's movements. Weeks 29-32, preparing for labor, discussion on birthing classes and birth plans. Baby shower preparations and nesting instincts. Weeks 33-40, final preparations, physical and emotional changes in the mother. Signs of labor and when to contact healthcare provider. Packing hospital bag and finalizing birth plan. Postpartum, labor and delivery, overview of labor stages and delivery options. Postpartum recovery and care for both mom and baby. Newborn care, basics of newborn care, feeding and sleep. Emotional adjustments and potential postpartum support. Remember, this is just an outline. Feel free to expand on each point based on your audience and the depth you want to cover.
10 healthcare needs of pregnant teenagers and their babies. 1. Pregnant teenagers have unique healthcare needs that require specialized care and attention. 2. Prenatal care is critical for ensuring a healthy pregnancy and reducing the risk of complications for both the mother and baby. 3. Teenage mothers are more likely to experience pregnancy-related complications, such as preterm labor and low birth weight babies. 4. Adequate nutrition and regular exercise are essential for the health of both the mother and baby during pregnancy. 5. Teenage mothers may require additional emotional and psychological support throughout their pregnancy and after giving birth. 6. Babies born to teenage mothers are at higher risk of health problems and developmental delays. 7. Early and regular pediatric care is essential for ensuring the health and development of babies born to teenage mothers. 8. Teenage mothers may require education and support in breastfeeding, as breast milk provides essential nutrients and immunity for babies. 9. Family planning and contraception counseling should be provided to teenage mothers to prevent unintended pregnancies in the future. 10. Providing comprehensive healthcare services to pregnant teenagers and their babies is crucial for improving maternal and child health outcomes.
Welcome back to our channel. Today, we're diving into the topic of normal delivery and discussing whether it's the right choice for expecting mothers. Giving birth is a transformative experience, and there are various methods available. Let us explore the pros and cons of opting for a normal delivery. Point 1. Natural process. Host. Normal delivery, also known as vaginal birth, is a natural process that has been practiced for centuries. Many argue that it is the way our bodies are designed to bring new life into the world. Pro. Natural process. Normal delivery allows the mother to experience the natural progression of labor, which can enhance the bond between mother and child. It also allows the mother's body to release hormones, such as oxytocin, which aid in breastfeeding and postpartum. Recovery. Con. Pain and discomfort. While normal delivery is a natural process, it can involve intense pain and discomfort during labor. This can be challenging for some women, and pain management techniques like breathing exercises and epidurals may be necessary. Point 2. Faster recovery. Host. Another aspect to consider is the recovery period after childbirth. Let us take a closer look at the pros and cons related to recovery. Pro. Faster recovery. Compared to a cesarean section, normal delivery typically results in a shorter hospital stay and faster postpartum recovery. Women who have a normal delivery may find it easier to resume their daily activities and care for their newborn. Con. Physical trauma. Despite the faster recovery, normal delivery can cause physical trauma, such as perineal tears. Recovery from these tears can take time and require additional care and attention. Point 3. Lower risk of complications. Host. Ensuring the safety of both the mother and baby during childbirth is a top priority. Let us discuss the pros and cons associated with the risk of complications. Pro. Lower risk of complications. In many cases, normal delivery is considered a safer option compared to cesarean sections. It carries a lower risk of infection, blood loss, and complications related to anesthesia. It also promotes natural immune system development for the newborn. Con. Unpredictability. Normal delivery is not without risks. Complications such as umbilical cord prolapse or shoulder dystocia can occur during labor. These situations require immediate medical intervention to ensure the well-being of both mother and baby. Point 4. Support and guidance. Host. Having a strong support system and access to guidance is crucial during childbirth. Let us explore the pros and cons related to support and guidance during normal delivery. Pro. Emotional support. Many women find comfort and reassurance in having their loved ones present during labor. The support of a partner, family members, or a doula can help alleviate anxiety and provide encouragement. Con. Limited control. While having a support system is beneficial, the process of normal delivery can sometimes be unpredictable. This lack of control can be challenging for some women, leading to increased stress and anxiety. Conclusion. Host. In conclusion, the decision to opt for a normal delivery or any other birthing method is a personal one that should be made after careful consideration. Let us summarize the pros and cons we've discussed. Normal delivery is a natural process that promotes the release of beneficial hormones and strengthens the mother-child bond. Faster recovery and shorter hospital stay are advantages of normal delivery, but physical trauma such as perineal tears may occur. Emotional support during labor can be comforting, but the lack of control in the process can cause stress and anxiety. Remember, every pregnancy is unique, and it's essential to consult with healthcare professionals to make an informed decision. We hope this video has provided you with valuable insights to help you make the best choice for yourself and your baby. Don't forget to like and subscribe.
Journey through the stages of pregnancy. Objectives. Define the 3 main stages of pregnancy: the first trimester, second trimester, and third trimester. Identify and describe the approximate duration of each pregnancy stage, including the weeks and months. Explain the physical and hormonal changes that occur during each pregnancy. What is pregnancy? Pregnancy is a biological process in which a woman's body nurtures and develops a fertilized egg, leading to the growth and development of an embryo and fetus inside the uterus. It occurs when a sperm cell fertilizes an egg, resulting in the formation of a zygote. The stages of pregnancy are typically divided into 3 trimesters, each approximately 3 months long. Throughout pregnancy, the fetus grows and develops, forming organs, tissues, and body systems. The average duration of pregnancy is around 40 weeks, calculated from the first day of the woman's last menstrual period. First trimester pregnancy. Pregnancy weeks 1 to 4. Fertilized egg travels down the fallopian tube and implants into the uterine lining. The fertilized embryo begins to form and consists of a cluster of cells. Development of the neural tube, which will become the brain and spinal cord, begins. Formation of the placenta connecting the embryo to the mother's bloodstream. Pregnancy weeks 5-8. The embryo grows rapidly. Basic features of the baby begin to take shape. The umbilical cord forms, connecting the baby to the placenta. The neural tube closes, marking the completion of the baby's spinal cord. The placenta grows and takes on a crucial role in pregnancy weeks 9-13. Major organ systems have formed, and the baby's structure is more defined. The fetus develops fingers and toes, which are initially webbed but begin to separate. Facial features become more distinct, and the eyes may move closer together. Muscles develop, allowing the fetus to make spontaneous movements. Second trimester pregnancy weeks 14 to 17. many of the major organs and body systems functioning or nearing functionality. Fine hair called lanugo begins to cover the baby's body to provide insulation. Bones continue to harden and muscles develop, enabling coordinated movements. The baby starts to practice swallowing and can even suck its thumb. Pregnancy weeks 18 to 22. The baby experiences a substantial growth spurt with an increase in size and weight. The baby's senses continue to develop, and it can now hear sounds from the outside world. The skeleton continues to develop, and the bone marrow produces red blood cells. A waxy substance starts to form on the baby's skin to protect it in the amniotic fluid. Pregnancy weeks 23 to 27. The baby's growth continues at a rapid pace, and their body becomes more proportionate. Lungs continue to develop, and respiratory movements, such as practice breathing, occur. Skin becomes less translucent as fat deposits start to develop beneath the skin. Eyelids and eyebrows are fully formed, and the baby's eyes begin to open. Third trimester, pregnancy, weeks 28 to 31. Brain development progresses, with the nervous system becoming more complex. The baby's position may shift, with the head typically moving downward into the pelvis. Movements may be more vigorous as they have limited space in the uterus. Organs continue to mature, increasing their readiness for independent functioning. Pregnancy weeks 32 to 35. The baby gains more weight, accumulating fat layers under their skin for energy reserves. The baby's head settles deeper into the pelvis, positioning itself for delivery. Organ systems further mature and develop in preparation for life outside the womb. Movements may feel more restricted due to increasing size and limited space. Pregnancy weeks 36 to 40. The baby's growth slows down, but they continue to gain weight and size. The baby's head becomes engaged in the pelvis, settling into a position for birth. The baby's organs are fully developed and ready for independent functioning. The baby's bones and skull remain flexible to facilitate the birthing process.
Ten best foods for boosting fertility in women. Introduction. Greet your audience and introduce the topic. Mention the importance of nutrition in fertility. Point 1. Fruits and vegetables. Highlight the benefits of vitamins, minerals, and antioxidants. Provide examples of fertility-friendly fruits and vegetables. Point 2. Leafy greens. Emphasize the role of folate in reproductive health. Recommend specific leafy greens like spinach and kale. Point 3. Whole grains. Discuss the benefits of complex carbohydrates and essential nutrients. Suggest whole grains such as quinoa, brown rice, and oats. Point 4. Lean proteins. Explain the importance of protein without excess saturated fats. Recommend sources like poultry, fish, and plant-based proteins. Point 5. Nuts and seeds. Highlight the nutritional value of healthy fats, protein, and minerals. Name specific nuts and seeds beneficial for fertility. Point 6. Fatty fish. Discuss the role of omega-3 fatty acids in promoting fertility. Recommend fish options like salmon, mackerel, or sardines. Point 7. Dairy or alternatives. Stress the significance of calcium and vitamin D for reproductive health. Suggest dairy products or alternatives like fortified plant-based milk. Point 8. Avocado. Talk about the benefits of monounsaturated fats and folate in avocados. Provide creative ways to incorporate avocados into the diet. Point 9. Berries. Discuss the antioxidant-rich nature of berries. Name specific berries like blueberries and strawberries. Point 10. Water. Explain the importance of staying hydrated for overall health and fertility. Encourage viewers to prioritize water intake. Conclusion. Summarize key points. Invite viewers to share their thoughts or ask questions in the comments. Remember to engage your audience, maintain a conversational tone, and include any additional information or personal anecdotes that can enhance the video.
Menopause and Hormonal Changes Guide Tips Intro. Hey there, wonderful people. Welcome back to Healthcare Lover. Today we're diving deep into a topic that affects so many incredible women out there. Menopause and hormonal changes. Yes, we're unraveling the mysteries behind those 15 crucial points. So, grab a cup of tea, get cozy, and let's get started. Point number one, understanding the basics. Menopause is a natural biological process that every woman goes through, typically in her late 40s or early 50s. It marks the end of the menstrual cycle and fertility. But what exactly happens during this time? Let's find out. Point 2. Hormonal roller coaster. As women approach menopause, there's a significant drop in estrogen and progesterone levels. These hormonal fluctuations can lead to a variety of symptoms, from hot flashes to mood swings. Ladies, you are not alone in this. Point 3. Impact on mood and emotions. Hormones play a crucial role in regulating our emotions. During menopause, the hormonal imbalance can contribute to mood swings, irritability, and even anxiety. It's essential to acknowledge and address these changes. Point 4. The infamous hot flashes. The notorious hot flashes. We've all heard about them, but what could eat? Stay tuned as we explore this in point number 4. Point 5. Sleep disturbances. Menopause often brings along sleep challenges. From insomnia to night sweats, getting a good night's sleep can become quite the struggle. But fear not, we'll discuss strategies to help you catch those Z's. Point 6. Weight gain and metabolism. Hormonal changes can affect metabolism, making it easier to gain weight, especially around the abdominal area. But fret not, we've got tips to help you maintain a healthy lifestyle during this phase. Point 7. Bone health. Estrogen plays a crucial role in maintaining bone density. With its decline during menopause, the risk of osteoporosis increases. Let's delve into how to support your bones through nutrition and lifestyle choices. Point 8. Memory and cognitive changes. Some women experience changes in memory and cognitive function during menopause. We'll explore these changes and share strategies to keep your mind sharp. Point 9. Skin and hair transformations. Hormonal changes can impact the skin's elasticity and lead to hair thinning. But worry not, we've got beauty tips to help you embrace and enhance your natural radiance. Point 10. Sexual health during menopause. Let's address the elephant in the room. Changes in hormones can affect libido and vaginal health. We'll discuss open communication with your partner and ways to maintain intimacy. Point 11. Managing stress. Menopause can be a stressful time, but stress exacerbates symptoms. Learn effective stress management techniques to navigate this phase with grace. Point 12. Hormone replacement therapy, HRT. For some women, HRT can be a game changer in managing menopausal symptoms. We'll explore the pros and cons to help you make an informed decision. Point 13. Nutrition and supplements. A balanced diet and specific supplements can alleviate menopausal symptoms. Let's explore the foods and nutrients that can make a positive impact on your well-being. Point 14. Exercise and its role. Regular physical activity can make a significant difference in how you experience menopause. Discover the types of exercises that can boost your mood and overall health. Point 15. Embracing the journey. Menopause is a transformative period, and embracing the changes is key. We'll leave you with empowering tips to celebrate this new chapter of life. Outro. And there you have it, folks. 15 points to demystify menopause and hormonal changes. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Healthcare Lover for more insightful content, and hit that notification bell so you
Start with a warm welcome and a brief introduction to the topic. Mention the importance of understanding ovulation for those trying to conceive or practicing contraception. Point 1. Know your menstrual cycle. Explain that ovulation occurs in the middle of your menstrual cycle. Discuss the typical menstrual cycle length, which is around 28 days, but can vary. Emphasize that tracking your cycle is essential. Point 2. Start with day 1. Explain that the first day of your menstrual bleeding is considered day 1 of your cycle. Point 3. Calculate your cycle length. Instruct viewers to record the number of days between the start of one period to the start of the next for a few months. Highlight that cycle length can vary and may not always be the same. Point 4. Determine your ovulation window. Mention that the ovulation window is usually around the midpoint of the cycle. To find it, subtract 14 from your average cycle length. For example, if your cycle is 28 days, subtract 14 to get 14. Your ovulation window is around day 14. Point 5. Use ovulation prediction kits. OPKs. Explain that OPKs can help pinpoint ovulation more accurately. Describe how to use OPKs by following the package instructions. Point 6. Monitor basal body temperature. BBT. Discuss how a woman's basal body temperature rises slightly after ovulation. Instruct viewers to use a basal thermometer and take their temperature every morning before getting out of bed. Point 7. Track cervical mucus changes. Explain that cervical mucus changes in consistency throughout the menstrual cycle. Describe how to observe and record these changes. Point 8. Pay attention to ovulation symptoms. Mention common symptoms like mild pelvic pain, breast tenderness, or heightened senses. Stress that these symptoms are not definitive but can be additional indicators. Point 9. Keep a ovulation calendar. Encourage viewers to create an ovulation calendar. Use a calendar or a smartphone app to track cycle length, OPK results, BBT, and other relevant data. Point 10. Be patient. Remind viewers that it may take a few months of tracking to accurately predict ovulation. Highlight the importance of patience and persistence. Conclusion. Summarize the key points discussed in the video. Remind viewers that understanding their ovulation cycle can be helpful whether they are trying to conceive or manage contraception. End with a call to action. Encourage viewers to subscribe, like, and share the video. Invite them to ask questions or share their experiences in the comment section. Hey there, lovely viewers. We're thrilled to have you back on our channel. Today, we're diving deep into a topic that's close to many hearts: how to boost your chances of getting pregnant. Whether you're just starting your journey or have been trying for a while, these detailed tips could be the key you're looking for. Point 1. Understand your menstrual cycle. Your menstrual cycle consists of different phases: follicular, ovulation, and luteal. Ovulation usually occurs around the middle of your cycle. Keep track of it using methods like basal body temperature or ovulation predictor kits. The fertile window spans a few days before and after ovulation, so aim for intimacy during this time. Point 2. Maintain a healthy lifestyle. Nutrition plays a pivotal role in fertility. Incorporate a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats into your diet. Regular, moderate exercise can help regulate your hormones and boost overall well-being. Stress can interfere with ovulation. Practice stress reduction techniques like meditation, mindfulness, or even enjoyable hobbies. Point 3. Maintain a healthy weight. Being underweight can disrupt hormonal balance, while excess weight can lead to insulin resistance and irregular cycles. Aim for a BMI within the healthy range for optimal fertility. Point 4. Avoid harmful substances. Smoking can decrease fertility in both men and women. Quitting is a major step towards improving your chances. Limit alcohol consumption, as excessive intake may affect hormone levels. High caffeine intake has been linked to reduced fertility, so consider cutting back. Point 5. Preconception health check. Before embarking on your pregnancy journey, schedule a thorough health checkup with your doctor. Discuss any pre-existing conditions, medications, or supplements you're taking that could impact fertility. Point 6. Stay hydrated. Drinking enough water helps maintain healthy cervical mucus, which plays a role in fertility. Point 7. Timing matters. It's important to remember that pregnancy might not happen right away. Continue trying during your fertile window, but don't stress if it takes some time. Point 8. Communication is key. Openly communicate with your partner about your feelings, concerns, and expectations. Keep the lines of dialogue open throughout the journey. Point 9. Seek professional help if needed. If you're having trouble conceiving, don't hesitate to consult a fertility specialist. They can perform tests to identify any underlying issues and recommend appropriate treatments. Conclusion. Thank you so much for joining us today as we explored these comprehensive tips for increasing your chances of getting pregnant. Remember, each person's fertility journey is unique, so be patient and kind to yourselves. If you found this video helpful, don't forget to give it a thumbs up, share it with others, and hit that subscribe button for more insightful content.
The effects of teenage pregnancy, 20 key points. 1. Introduction. Hello everyone, welcome back to our channel. Today, we're diving into a crucial topic, the effects of teenage pregnancy. 2. Higher health risks. Teenage mothers often face higher health risks during pregnancy compared to older women. 3. Educational challenges. Teen moms are more likely to drop out of school, limiting their educational and career opportunities. 4. Economic impact. Teenage pregnancy can contribute to financial strain on families and communities. 5. Emotional stress. Young parents may experience heightened emotional stress due to the challenges of parenthood at an early age. 6. Impact on mental health. Teenage mothers are at a higher risk of experiencing mental health issues such as depression and anxiety. 7. Social stigma. Teen moms often face social stigma and judgment from peers and the community. 8. Parenting skills. Being a parent requires skills that young individuals might not have fully developed, impacting effective parenting. 9. Relationship strain. Teenage pregnancies can strain relationships, leading to higher rates of breakups. 10. Limited social life. Young parents may find it challenging to maintain an active social life due to parenting responsibilities. 11. Child development. Children born to teenage parents may face developmental challenges. 12. Single parenthood. Teenage pregnancies often lead to single parenthood, which can be challenging for both the parent and child. 13. Healthcare access. Access to proper healthcare may be compromised, affecting both maternal and child health. 14. Generational cycle. Teenage pregnancy can perpetuate a cycle, as children of teen moms may be more likely to become teen parents themselves. 15. Limited career opportunities. Teen moms often face difficulties pursuing and maintaining careers, impacting their financial independence. 16. Child poverty. Children of teenage parents are at a higher risk of living in poverty. 17. Higher rates of preterm births. Teenage pregnancies are associated with higher rates of preterm births, affecting the baby's health. 18. Child abuse. Risk. Teen parents may be at a higher risk of unintentional child abuse due to lack of experience and stress. 19. Impact on educational goals. Teen moms may struggle to achieve their educational goals, limiting their potential in various fields. 20. Prevention and support. It's crucial to focus on prevention and provide support systems to help reduce the impact of teenage pregnancy on individuals and society. Closing. Thanks for joining us today. If you found this video informative, don't forget to like, share, and subscribe. Let's continue the conversation in the comments below. Until next time, stay informed.
Introduction, greetings and welcome. Mention the importance of a healthy diet during pregnancy. Point 1. Balanced diet. Emphasize the need for a well-balanced diet. Include a variety of food groups, fruits, vegetables, whole grains, proteins, and dairy. Highlight the importance of getting essential nutrients from different sources. Point 2. Folic acid and iron. Discuss the significance of folic acid in preventing birth defects. Mention good sources of folic acid, leafy greens, citrus fruits. Fortified cereals. Highlight the importance of iron for preventing anemia during pregnancy. Include iron-rich foods, lean meats, beans, spinach, and fortified cereals. Point 3. Omega-3 fatty acids. Explain the benefits of omega-3 fatty acids for the baby's brain development. Include sources of omega-3s. Fatty fish like salmon, chia seeds, flax seeds, walnuts. Point 4. Adequate hydration. Stress the importance of staying hydrated during pregnancy. Recommend water as the primary beverage. Limit caffeine intake and avoid sugary drinks. Point 5. Calcium for bone health. discussed the need for calcium in supporting the baby's bone development include good sources of calcium, dairy products, fortified plant-based milk, leafy greens. Point 6. Small, frequent meals, suggest eating smaller, more frequent meals to ease digestion. Emphasize the importance of snacks with a balance of nutrients. Point 7. Foods to avoid, list foods that should be avoided during pregnancy: raw fish, unpasteurized dairy, excessive caffeine, etc. Explain the reasons behind these restrictions for the baby's safety. Conclusion: recap the key points. Encourage consulting with a healthcare provider for personalized advice. Invite viewers
(11 weeks pregnant, your baby's development. From an oversized head to tiny tooth buds, this week is full of exciting growth and changes, both big and small. Your baby's facial features are slowly maturing, with the ears now moving toward their final position on the sides of the head, and the eyes set wide apart with eyelids fused shut. Genitals are forming too, although it's still too early for your healthcare provider to tell if you're having a girl or a boy. But even though you don't know your baby's gender yet, why not start a list of your favorite baby names for boys and girls? Have some fun with our baby name generator. You still have plenty of time to browse and find a name you love. Tiny buds that will eventually become teeth are developing. The head makes up half the total body length at this stage, although in the coming weeks the body will grow significantly too. To support all this growing, your baby now needs more nutrients, so the placenta grows, and its red blood cells increase in number to meet this need. The size of the fetus at 11 weeks pregnant. At 11 weeks, the fetus is about the size of a Brussels sprout. From crown to rump, the average length is now 2 inches, and the average fetus weighs just about 0.33 ounce. Mom's body at 11 weeks pregnant. Are you having unusual food cravings this week? They're quite common. Between 50 and 90% of women experience these cravings at some point during pregnancy. No one knows for sure why pregnancy cravings occur. Some medical experts believe these cravings are your body's way of telling you what it needs, while others blame them on changing hormone levels. As long as your food choices are part of a healthy pregnancy diet, go ahead and eat up. There is a type of craving that needs medical attention. However, if you crave non-food items like clay or dirt, contact your healthcare provider. 11 weeks pregnant, your symptoms. At 11 weeks pregnant, here are some of the symptoms you may be experiencing. Breast growth. Your breasts may be a little larger now, and you can expect to see even more growth as your pregnancy progresses. Some of this may be because the milk glands grow in preparation for breastfeeding. You might gain up to 3 pounds of breast tissue over the course of your pregnancy. Increased vaginal discharge. Your body may be releasing more clear vaginal discharge now. This is normal as long as it is odorless and clear or white in color. If you notice changes including blood, itchiness, or a foul odor, contact your healthcare provider to rule out problems. Dark abdominal line. You might notice you have developed a long, dark line that runs vertically down the center of your belly. It's called the linea nigra, or the pregnancy line, and it's thought to be associated with hormonal changes. This line will likely fade after your baby's birth. Leg cramps. You may be troubled by tight, painful leg cramps, particularly at night. This can make it tough to get a good night's rest. Stretching can help with leg cramps, as can exercise. In some cases, mineral depletion may contribute to having leg cramps, so make sure that your diet is giving you enough calcium and magnesium, and take care to stay hydrated. Fatigue. Right now, your levels of the pregnancy hormone progesterone are increasing, which can sometimes make you sleepy when you'd rather be alert. And, if you've been waking to pee or having leg cramps or getting heartburn during the night, your sleep may be suffering too. Eliminating caffeine and following a relaxing bedtime ritual every evening can help fight pregnancy fatigue. Mood swings. You can thank your heightened hormone levels if you've been experiencing mood swings or moodiness lately. Try to avoid stress, and ensure you're getting enough iron in your diet. Practicing yoga, doing simple meditations, or relaxing while listening to soft music might help you feel a little better. You could also ask your healthcare provider for advice on dealing with your mood swings, particularly if they're interfering with your daily life. Morning sickness. You might experience queasiness and even vomiting at 11 weeks pregnant, and this can occur at any time of day. Morning sickness often subsides in the second trimester, though, and you're almost there. Baby development at 12 weeks. Your baby is about the size of a lime. Length: 2.13 inches. Weight: 2.05 ounces. Small movements. This week, your baby can open and close their hands, making a fist, and curl their toes. Tiny fingernails. Your baby has itsy bitsy nails growing on their fingers and toes. Your baby's intestines. The stomach and esophagus started forming around 7 weeks of pregnancy, and your baby's intestines grew so fast that they protruded into the umbilical cord. Soon, the abdominal wall will close and their intestines will make their way inside their abdomen. Your baby, although tiny, is now fully formed. They are about the size of a plum. The placenta is also now fully formed, although it will keep growing throughout your pregnancy. The placenta is your baby's life support system, passing oxygen, nutrients and antibodies from your blood supply to your baby. From now on, your baby is going to grow. Even though you can't feel it yet, your baby is moving, waving and dancing. They can also swallow. Your 12-week fetus is almost done developing their body's important systems and parts, which means it's all about getting bigger and more mature from here on out. Yep, baby's about to enter the growth and maturation stage, in which organs and tissues will grow and develop rapidly. Baby at 12 weeks is opening and closing their fingers and curling their toes, and their brain is developing fast. Baby is now developing reflexes. If you poke your 12-week pregnant belly while looking at baby on an ultrasound, you'll likely see movement. If you're 12 weeks pregnant with twins, your twosome is developing at a similar rate as singleton babies at 12 weeks. Later on, they'll have a slightly slower rate of growth.
Early pregnancy symptoms at 12 weeks. Your signs of pregnancy may include an aching stomach, nausea, mood swings, a metallic taste in your mouth, sore breasts, indigestion and heartburn, headaches, dizziness, new likes and dislikes for food and drink, a heightened sense of smell, a white milky pregnancy discharge from your vagina, light spotting, see your doctor if you get bleeding in pregnancy, cramping, a bit like period pains, darkened skin on your face or brown patches, this is known as chloasma or the mask of pregnancy, greasier, spotty skin, thicker and shinier hair, bloating and the feeling of being bloated.
"14 weeks pregnant. Your baby's development. Welcome to your second trimester. Your little one is trying out some new moves this week. Your baby's eyes are starting to move, and those little legs and arms are starting to flex. These movements also allow your baby to practice the important skill of moving hands to mouth. The senses of smell and taste are also developing, and your baby's skin is thickening too. You'll have to wait and see if your baby will be born with a full head of hair or not, but right now, hair follicles are forming under the surface of the skin. With each passing week, your baby is looking more and more like the little person you'll meet the day you give birth. By now, or very soon, the genitals are fully developed. But it's still too early to know whether you're having a boy or a girl. How big is my baby at 14 weeks? At 14 weeks, Your baby is growing and developing rapidly, measuring between 3.5 and 4 inches long and weighing around 2 ounces, about the size of a navel orange. The size of the fetus at 14 weeks pregnant. At 14 weeks, the fetus is roughly the size of a nectarine. Around this time, the average fetus weighs about 1.5 ounces and can measure up to 3.5 inches long, crown to rump. Making faces. Thanks to brain impulses, your baby's facial muscles are getting a workout. Those tiny features can squint, frown, and grimace. Your baby is also making sucking and chewing movements. Growing hair. Soft baby hair is coming. Hair follicles have started to form deep in your baby's skin. Around 20 weeks, fine downy hair will sprout from these follicles on your baby's eyebrows, upper lip, and chin. Your active baby. Though you can't feel those tiny punches and kicks yet, your baby is quite active and has flexible hands and feet. Mom's body at 14 weeks pregnant. You've finally reached the second trimester. Pregnancy symptoms during week 14. No more morning sickness? Your energy is likely returning, and your queasiness may have eased by now. If not, hang on, chances are good that morning sickness will soon be behind you if it's not already. Although it's uncommon, some expecting moms will still feel nauseated months from now. Tell your healthcare provider at your next appointment if you're still having nausea or vomiting. Starting to show. The top of your uterus is a bit above your pubic bone, which may be enough to push your tummy out a tad. Starting to show can be quite a thrill, giving you and your partner visible evidence of the baby you're waiting for. Bleeding gums. About half of pregnant women have swollen, red, tender gums that bleed when flossed or brushed. This gum inflammation, called pregnancy gingivitis, is partly caused by hormonal changes that make your gums more sensitive to the bacteria in plaque. Be sure to brush your teeth twice daily and floss daily. Round ligament pain. On either side of your uterus, you have 2 ligaments that stretch and thicken to accommodate your growing belly. These changes may cause round ligament pain. It can feel like a short, stabbing pain in response to movement, or a dull ache after an especially active day. If round ligament pain strikes, try to stop and rest, pay attention to your posture, change positions, gently massage the area, or take a warm bath. Some women find that wearing a maternity belt for extra support helps relieve the pain. Increased appetite. Pregnancy hunger starts and peaks in the second trimester. Your body is working hard to support your baby, and that requires plenty of energy. Your meals are also fueling your body's pregnancy changes, which include a much higher blood volume, your growing breasts and uterus, and increased fat stores. You need an extra 300 to 350 calories per day in the second trimester. Round ligament pain. For some women, a possible side effect of uterine growth is what your OB/GYN would call round ligament pain. Basically, these are pregnancy growing pains that feel like achy or sharp pains on one or both sides of the abdomen. That begin to appear around 14 weeks but can strike at any time during the second trimester. Here's why. The uterus is supported by thick bands of ligaments that run from the groin up the side of the abdomen. As your uterus grows, the supporting ligaments stretch and thin out to accommodate the increasing weight. This weight pulls on the ligaments and causes a sharp pain or a dull ache in your lower abdomen. It's often more noticeable when you change positions suddenly or quickly get up from sitting or lying down, or when you cough or sneeze. The best way to bring relief? Put your feet up and rest in a comfortable position, which should ease the strain and the pain. Baby development at 15 weeks. Your baby is about the size of an apple. Your baby is around the size of an apple or a navel orange. It measures around 4 inches, 10 centimeters, from crown to rump. It weighs approximately 70 grams, which is equivalent to 0.15 pounds. Baby weight at 15 weeks is similar to the weight of 1 chicken egg. Your baby at week 15. Pregnancy week 15, fetal development. Your baby at 15 weeks pregnant has already formed all its vital organs, so now it's time to grow bigger and stronger. Among the milestones of week 15 of pregnancy fetal development is the beginning of bone ossification. The muscles are strengthening, and the bones are becoming harder. By now, the baby has longer limbs and can move its joints. Although it's not common, some women can feel baby movements at 15 weeks pregnant. Your baby is also practicing how to breathe outside your womb. She is actively drawing in amniotic fluid through her nose. It is getting into the upper respiratory tract, developing the lungs. The baby's skin is still very translucent, and small blood vessels are forming under it. Your 15-week fetus is also practicing other reflexes, such as swallowing and sucking. At 15 weeks of pregnancy, your baby is also looking much cuter, since its head is now proportional to the rest of its body. Their skin is getting covered in very fine hair, which is called lanugo and helps keep the baby warm. In the womb, a 15-week baby is also able to hear your voice. Make sure you talk to your baby constantly. How big is my baby at 15 weeks? Curious why your body is, probably, finally starting to look pregnant? It's because at 15 weeks pregnant, your baby is quickly growing bigger each week. He's as long as 4 inches right now and weighs around 2.5 ounces. Baby is looking more like a baby. With each passing week, your fetus is also looking more and more like the baby you're picturing in your dreams. By now, the ears are positioned properly on the sides of the head, they used to be in the neck, and the eyes are moving from the side of the head to the front of the face, where they'll soon meet your loving gaze. Sense of taste. Your baby is forming taste buds, and nerves begin connecting them to the brain. By about 20 weeks, your baby's taste buds will be fully formed. During pregnancy, molecules of what you eat pass through your bloodstream and make it into your amniotic fluid. But your baby doesn't actually taste what you're eating, so don't worry that they won't enjoy what you're having for dinner. Baby movement. Your baby's legs are growing longer than their arms now, and they can move all of their joints and limbs. Your active baby is moving constantly, though you can't feel it yet. Your baby's face. Your baby is looking more like a little person, with eyelids, eyebrows, eyelashes, nails, hair, and well-defined fingers and toes. If you could see inside your womb, you'd catch your baby sucking a thumb, yawning, stretching, and making faces. What's happening in my body? Your baby is growing quickly and comes with a lot of packaging, the amniotic sac and fluid, and their own food supply, placenta. You could start getting the odd jabbing pain on the sides of your bump. This is known as round ligament pain. Putting your feet up and resting can help. Your skin could also feel a bit itchy. It might help to use an unperfumed moisturizer, wear loose cotton clothing, and have a cool bath. If the itching gets worse, especially at night, talk to your doctor or midwife. 15 weeks pregnant lifestyle. Make sure you're getting enough calcium. Since your baby's bones are beginning to ossify, calcium is more important than ever. A prenatal supplement should be able to provide the calcium you need, but you can also increase your dietary intake for an extra boost. Monitor your weight gain. Drastic weight gain can be a sign of preeclampsia. Talk to your doctor if you think you're gaining too many pounds. Keep a healthy diet. You've probably made some healthy dietary changes in the previous weeks, and your 15 weeks pregnant diet should stay healthy. This will help you avoid excessive weight gain. Stay safe. Although it's advisable to exercise during your pregnancy, 15 weeks pregnancy precautions include avoiding contact sports or sports that carry a risk of falling, like horse riding. Go to the dentist. It might not be pleasant, but taking care of your teeth can actually lead to a healthier pregnancy. Women who develop gingivitis during pregnancy have a higher risk of complications, including preterm birth. Second trimester pregnancy symptoms at 15 weeks. Your pregnancy symptoms may include swollen and bleeding gums, pains on the side of your belly, caused by your expanding womb, known as round ligament pains, headaches, nosebleeds, feeling bloated, indigestion and heartburn, sore breasts, leg cramps, feeling hot, dizziness, swollen hands and feet, urine infections, vaginal infections, darkened skin on your face or brown patches, This is known as cloasma or the mask of pregnancy. Greasier, spotty skin. Thicker and shinier hair. You may also experience symptoms from earlier weeks, such as morning sickness, a heightened sense of smell, mood swings, a white milky pregnancy discharge from your vagina, and light spotting. Seek medical advice for any bleeding.
The size of the fetus at 16 weeks pregnant. At 16 weeks, your fetus is now the size of an apple. Your little one could be more than 4.5 inches long, crown to rump, and weigh close to 4 ounces. How big is my baby at 16 weeks? Your baby now weighs in at a whopping 3 to 4 ounces, and is 4 to 5 inches in length. The backbone and tiny muscles in your baby's back are gaining strength, so she can straighten out that head and neck even more. Thanks to those developing facial muscles, your baby is capable of making a few expressive frowns and squints, even at this early stage. Baby's beautiful eyes are finally working too, making small side-to-side movements and perceiving light, although the eyelids are still sealed. Delicate baby skin. Your baby's skin is thin and translucent. It will thicken and develop as your pregnancy progresses, but will continue to be almost transparent for quite some time. And here's the skinny on baby skin, it's practically translucent now, so if you took a peek inside your uterus, you'd be able to see your baby's blood vessels under that thin skin. Scalp patterning. On your baby's scalp, hair follicles are forming a pattern that will remain for life. This patterning sets the stage for how your baby's hair will grow. New hair follicles don't form after birth, so babies are born with all the hair follicles they'll ever have. Heart at work. Your baby's heart is now pumping about 25 quarts of blood each day, and this amount will continue to increase as your little one develops. Baby will soon hear your voice. Listen up, tiny bones in your fetus ears are in place, making it likely that baby will soon be able to hear your voice, or something like it, when you're speaking. Generally, babies fully develop the ability to hear in the womb by 18 weeks of pregnancy. During its 16th week of development, a fetus will be starting to form facial expressions, and its nervous system will be growing. Your body at week 16. Rapid growth. At 16 weeks pregnant, your uterus is growing at about the same pace as your baby's. It's getting to the point where you may not be able to hide your pregnancy anymore, even if you wanted to. Your 16 weeks pregnant belly. At 16 weeks pregnant, you may now be at the stage where your bump clearly has a baby in there. Your pregnancy weight gain. It may be hard to watch yourself gain weight during pregnancy, even when you know there's a wonderful reason for it, but try to embrace your body's new shape and think of every pound you put on as a sign of good health for you and your baby. Nasal congestion. 16 weeks pregnant, your symptoms. At 16 weeks pregnant, here are some of the symptoms you may be experiencing. Skin changes. You might have heard about the pregnancy glow, and now it might be your turn to experience it. Increased blood volume in the blood vessels and pregnancy hormones causing more oil production can make pregnant skin look flushed and dewy. Nosebleeds. At 16 weeks pregnant, nosebleeds can be an issue for some moms-to-be, and might be caused by increased circulation and higher levels